Jeremy and I are going to be chatting right now about moral fatigue and PTSD. We're just going to wait a minute for some people to pop on here before we get started. So why don't you tell us just a little bit quickly about policing in Kentucky, just for a second while people are popping on.
Okay. Well, I've only been a police officer in Kentucky since 2006. Prior to that, though, I started in 1995 in a little town called Blytheville, Arkansas. So I've been policing for almost 25 years now. Through my time, I've worked everything from the road to street-level narcotics, member of the special response team, was a detective for crimes against women and children, so I did all of the sexual assaults, domestic violence, and I am currently back on patrol, working second shift as a lieutenant, so I'm a supervisor, and life has been pretty good, pretty fun, but like most people who've been in law enforcement, it's had its rather stressful times that have really taxed who I am as a person, and that's kind of what got me interested in understanding basically the mentality and how post-traumatic stress disorder works, how it doesn't work, what does it actually mean for me in my career. So that's where it all got started. I guess beginning started years and years ago with a very traumatic incident that I hadn't discussed with anyone for over a decade. I kept quiet, was at a command school, and you want to quiet a room of lieutenants and captains really quick. They had an open question and said, what are some issues that are facing supervisors today? And so my question was, as a supervisor, what is our responsibility for the mental health of our officers? Dead quiet. There was no answer. Very little discussion because it's a very uncomfortable. Yeah. Because there are a lot of unknowns and so many go into it. What are my personal feelings? How can I help? What can I do? What can't I do? If I start helping, what do I have to tell the agency? What do I have to disclose? If I start taking medication, do I have to tell my agency that I'm taking medication? If I start taking medication, do I lose my job? Am I prevented from promotions? So there was a whole lot of things that went on that just weren't discussed. One of the instructors goes, hey, I've got a class for you. It's called the Post-Critical Incident Seminar. So I went, and it is very uncomfortable the first day, because the first day of the seminar, all of the officers and their spouses are sitting around in a U shape, and they start at one end of the table and say, what is your traumatic incident and why are you here? And it's a very long day as you start hearing all of these officers discussing what brought them there. Initially, I had said I would talk about my shooting. When I was shot, it didn't bother me as much as it should have, apparently. But that's because by this time I had done a lot of studying. In 2013, in fact, January 30th of 2013, was talking to a gentleman who had done a home invasion to steal medication. Told him that he was under arrest. He had to go with us. Took off towards the back bedroom. Myself and two other officers were chasing him down the hallway. He slammed the door, and all you could hear was the rack of a gun. We all scattered, tried to convince him it was okay. We could still work this out. And that's when he started shooting. Because he could hear me talking, that's where he was shooting at. Unfortunately, he ended up dying. The media didn't help. While I was still on scene, before I could call my family, it was released to the news, not just the incident, but my name, It hit social media before I could even call my family and let them know that I was okay. So that was kind of rough, and I figured that's what I would talk about at the seminar. But as I started hearing all these other officers opening up about the personal things that really bothered them, one of the things the moderator said is, pick what really bothers you the most. So I did. And it was having to listen to a 7-month-old burn alive. And that stuck with me for a long time. And I really struggled with it. It actually developed into PTSD that I tried to manage on my own for over a decade. At the seminar, there were some things that we did. I was introduced to EMDR, which is eye movement desensitization and reprocessing. Very non-invasive way to deal with trauma, and it helps kind of, and as we start talking about PTSD and what it is and how the brain works, it makes sense. It kind of takes the right side of the brain, these abstract thoughts, and files them away in the left side of the brain into the card catalog of, okay, this is where it needs to be. And with PTSD, what it does is it never actually makes it from the right side to the left side. It kind of gets stuck in between. And that's what causes a lot of the issue. I did 7 months of therapy once a week, every week, to finally work through it. As I got through it, really began to understand that there were some other things underlying, and moral injury was one of those. So that's where it all started.
Thank you for sharing that. I know that when I speak with officers quite often, and I deal with the physical signs, and they'll start telling me about certain things where their sleep started getting bad or where their digestive system started getting off. And I'll quite often ask them if something happened around that time. It may have been like, it's 7 years, 10 years, 2 years, like months. And if I ask them, they're like, yeah, there was, quite often it's an incident that they remember. And I do know with kids is one that I hear often, especially if somebody has a child around that age. And they don't realize that on top of what we're going to be talking about today, from these instances about the mental aspect that it does affect you, it also affects your physical system.
Sure.
And so that's where I know, like I do hear a lot of these stories. And so for me, this has been so helpful in you talking with me to help me understand the mental side of it and how that affects it, and how to help those that are coming to me, that I can help the physical, but also how to get them the help for the experience that they are having and the memories that they're reliving.
Sure. And the mental and physical are tied together.
Yeah.
Unbelievably.
Mm-hmm.
The mental aspect puts the strain on it. But after this incident, I was sleeping 1 to 2 hours a night.
I hear that.
And after a decade of that lifestyle, the physical part of it, just the wear on my body, is what made me say something has to change. And one of the things that I talk about when I'm talking with recruits is I hate to fail at things. I had to do a sleep study because I wasn't sleeping, and it did start to affect me physically. And when a doctor says, hey, I'm going to give you some medicine to help you go to sleep, we're going to do all this stuff, and 2.5 hours later you wake up, and they say, well, that's not enough time, but I can't go back to sleep. And for them to tell you, I can't help you. The problems that you're having, I can't fix. What was kind of hard to hear, because that meant that at this point, I knew I had to address the mental aspect, because there was nothing they could do to help with the physical until the mental was taken care of.
On a side note of that, though, I do have experiences with those that I deal with, where we are able to start getting the hormones that are not allowing their brain to shut off at night and the hormones that are waking them up mid-sleep, balancing those. And we have many that have been for sleep studies and all of that, and we're told the same thing. And that's where I think there's that big gap as well between our medical system, where their training is all in crisis management, which we need them for.
Right.
Absolutely. And then there's that preventative side as well. So like they all play this part. And I think if we're missing one, we're not getting that whole puzzle piece together.
Well, in a lot of that too is what started this discussion with you and I was a post that I saw.
Yeah.
And unfortunately, doctors, realistically, especially here in the US, when you make a doctor's visit, you've got maybe 15 to 20 minutes to say, hey, this is what's going on. And if you yourself don't know, you say, doc, this is what I'm feeling, they're going to kind of give their best guess at it. Yeah. And when they send you to a specialist, specialists are great, but like you said, I'm only here to deal with the physical, and I can't help with the rest of it. Yeah. So until you get this fixed, we can't work on this. Mm-hmm. So it really is a holistic approach that's needed.
Yeah.
And that's why it's important for officers and just people in general to really understand, what am I feeling? What's going on? So that if you've only got that 15 minutes, you can say, you know what? I had this, and this go on. This is what I'm feeling. This is what I'm thinking. And then this is how I'm seeing it manifest physically. Because the more information you can give your doctor about how you feel and what you're thinking, the more able they are to point you in the right direction and get you on a program that will help you get better.
Absolutely. So that gets us into this PTSD, moral injury, and compassion fatigue. Do you mind breaking it down for us, explaining each with the symptoms? I know you have some great charts and stuff. If you don't mind,
sure,
you can take over the screen and help us all, because I know that you have done some amazing. You've explained it so well to me, and I was like, hey, everybody in here has to hear this. So, and you were very amazing to give us your time today. So yeah, if you could go ahead, take the screen and teach us.
I appreciate it. I was kind of debating on whether or not to throw the slides up. I hate slides. In fact, I try to minimize it as much as possible. Mm-hmm. But
found that the one that you had was really visual for me to see it. But that was the one that I really liked. And just for everybody listening, if anybody has questions, I'm keeping an eye on Facebook. If you have questions, post them in the comments, and we'll answer them as we go along.
So what's important for everybody to understand, first of all, is what exactly is stress and post-traumatic stress. And when we talk about stress, people don't realize that it's neither good nor bad in and of itself. In fact, a lot of times stress can be good for us. And the story that I like to use is, if you're a caveman and you don't have a bow and arrow, all you've got is a spear, and you have to hunt that saber-toothed tiger to eat, you need that stress response, because what it does is it primes the body and it preps the body for that fight, flight, or freeze. So some of the things that it does is it affects your vision. Pupils dilate and you focus in, and what we talk about now is tunnel vision. But you need that tunnel vision because that saber-toothed tiger is camouflaged with its surroundings. And so once you lock onto it, you need to keep track of it as it's running away and trying to evade you. So it's actually a good benefit. The other thing that it does is it increases your heart rate, respiration, pulse. It does all of these things, and it starts sending these hormones saying, we've got to get ready. Well, the oxygen going to your blood gets to your muscles, allows you to run faster, gives you the strength to chase it down. So all of these things are necessary. What's supposed to happen with stress is that once that is over, the sympathetic nervous system shuts down, The parasympathetic nervous system takes over and sends a different kind of hormone to kind of calm everything down and put it back to an even keel. So stress in and of itself is not bad. Think of it this way. I love to ride roller coasters. If you like to ride roller coasters or you like to do something that is in that same vein, what happens is you stand in line and you start getting closer to riding the roller coaster. Respiration goes up, pulse goes up, you start getting this anxious feeling, but it's not a bad anxious feeling, it's a good anxious feeling. The body can't tell the difference between good and bad. It's the mind that says, hey, this isn't a bad thing. This was kind of fun. I enjoyed it. Let's do it again. So it files it from that right brain to the left brain as a good thing, so that the next time you experience it, left side of the brain goes, oh, body, we know you're under stress, but it's a good thing. It's a happy thing. Life is fine. As opposed to like when I got shot. It hurt. Didn't like it. Didn't like the feeling. Said don't want to do it again. My brain was able to process it, file it away, so that the next time it happened, my body said, I'm under stress. It was my mind saying whether it was good or bad. And if you know what's going to happen, you can talk your way through it. My wife was a little upset because she felt that I was kind of about getting shot. She goes, it doesn't really seem to bother you. I said, well, that's because I understand what's happening. But the first time I put my vest on to go back to work, I was cleared for duty. I was getting ready to go back to work. I put my vest on and felt like I was going to have a heart attack. I couldn't catch my breath. My heart was racing. Things started to get fuzzy in my eyes. And if I hadn't been aware that this is a normal post-traumatic stress reaction, I had stress that was related to trauma, that this was going to happen, I probably would have called for an ambulance because I had no clue what was going on. But once I understood, because of the research that I had done, I knew that this was a normal response. It was just my body going, hey, wait, the last time I was wearing this, I got hurt. So we need to kind of figure out what's going on. Mentally, I had to tell my body, hey, it's all right, calm down. It's not the vest, it's not the uniform, it was a specific incident. Separate the two. That's why mentally and physically they're so tied together, because the body doesn't understand good or bad. It takes the mind to tell it whether it's good or bad. So I was able to sit down, process it, and of course, the parasympathetic nervous system took over and all those hormones flooded and said, okay, it's good. We can shut down. We don't have to be in this heightened state of alert. Things are fine. What's interesting about post-traumatic stress is it can happen anywhere from 2 days to 4 weeks after the incident, and that is completely fine. That is normal. You talk to a doctor, you talk to a psychologist, they will tell you that is absolutely normal. To have the dreams, to have the nightmares, to have the heightened startle response, all of that is absolutely normal, up to 4 weeks after the incident. After 4 weeks is when it might become a problem. And I say might because there's a lot of people that talk about, well, I have PTSD, but don't really understand what it means. They understand, I have a heightened startle response, I've got insomnia, I have bad dreams, and, it was 2 years ago that this incident happened, and I heard a song playing on the radio, and it brought it right back. That isn't necessarily post-traumatic stress disorder. That's still a post-traumatic stress because our emotions are tied to our senses. What we hear, what we see, what we smell, what we taste, what we feel, they're all tied together. So it's not necessarily a disorder. For it to be a disorder, and this is where it's important that people kind of understand it, according to the DSM-V, which are the diagnostic and statistician manual that basically says this is where, as a therapist or as a professional, we are going to diagnose you. These are the criteria. What happens is there are 4 different criteria that have to be met, okay? And one of those criteria is, is that cognition and mood, okay? You have to have something that negatively impacts your mood, your arousal and reactivity. And this is where I wanted to share this to kind of go through it. And let me get down to, nope, that's compassion fatigue. Okay, here we go. And I am going to just pull this up, and these are the 4 specific areas: the intrusive memories, the avoidance, cognition and mood, arousal and reactivity. All 4 of those have to be present for more than 30 days. Not just 1, not just 3, but all 4 of those have to be present for more than 30 days. And actually, for the cognition and mood and the arousal and reactivity, there are actually 2 different criteria that have to be met. So when you're talking about intrusive memories, that could be anything from daydreams to nightmares. Avoidance could be avoiding the situation, avoiding talking about it, avoiding the place where it happened, anything that kind of puts you out of not dealing with that. So under each of these 4 categories, there's different things that they're looking at, but you have to show symptoms in all 4 of these areas for more than 30 days. And what's kind of interesting is people say, well, I don't have a trauma, or I haven't had a trauma. Well, technically, to be diagnosed with PTSD, it has to be trauma related. That's why it's in the name, post-traumatic stress disorder. And I think as officers and first responders, a lot of times what we do is we minimize that trauma. We don't understand that there's this thing called complex or composite trauma, which means, you know, the first time that I had to deal with that horrific car wreck, that's a trauma. We aren't designed to see that, but I was okay with it. It wasn't that bad. The second one, it still wasn't that bad. But by the time I get to the 10th or the 11th or the 12th, it's not just that car accident, it's that buildup of the multiple car accidents. First time I work a child abuse case, sad, deal with it, it's okay, move on. The second time, the third time, the fourth. So we talk about big T's and little T's. That little trauma is something that a lot of first responders kind of push aside and say, well, it's not really trauma, it didn't bother me. Well, maybe yes, maybe no. It may have bothered you and you didn't realize it because you were able to process it. Your stress receptors, your mental ability, the social support that you have, whatever is in you helped you process that particular trauma. Doesn't mean that it wasn't traumatic, but it's a little T as opposed to the big T's. Like I said, getting shot, that was a big T. That is so far outside the realm of what is normal. So a lot of times when officers go and they talk with somebody, well, I've never had any trauma. I've done a 20-year career and I've never had any trauma, because what they're looking at is that big T. I was involved in a shooting. I worked a horrific homicide or something that, and I hate to use this terminology, but it's Hollywood. The movie says this is what, you know, first responders are. And if I didn't have one of those, then I haven't suffered trauma. but you have. It's just that little t. You were able to cope. But over that 20-year career, 20 years of little traumas turn into that large trauma. And this is way oversimplified. And if there are any mental health professionals, trust me, it works. I know it's not. But all post-traumatic stress disorder is your mind's inability to process what happened. Realistically, the long and the short of it is your mind is not able to process that. The reason that becomes such a big issue, though, is like we said, the mind and the body are tied together. And if you have those mental blocks and those mental issues, it starts to turn physical. I know you and I have talked a little bit about the hormones. And when I was talking about stress is neither good nor bad, it's how you deal with it in the mental aspect. Epinephrine, norepinephrine, all these things from the sympathetic nervous system start flowing into your body. And if the parasympathetic nervous system can't shut that down, that actually changes into cortisol. Cortisol is where you start running into issues because your body isn't used to having all that cortisol. And if you can't shut those receptors down, that's what causes the weight gain. That's what causes diabetes, your heart issues. It's actually, even in some of the research, Parkinson's disease, they believe, is caused by your body just having this overabundance of these stress hormones that it can't process.
Cancer, all of these things. Yeah.
All this list just goes on and on. And so when these officers start saying, or these first responders start saying, you know, I don't know where this came from. Look at the stress. Have you been able to shut down that sympathetic nervous system and actually relax? A lot of times officers can't. So it's important to understand post-traumatic stress disorder is a diagnosis. That is a doctor has to diagnose you, a medical professional, and the four things they're looking at are these intrusive memories, avoidance, cognition and mood, arousal, and reactivity. And they have to, all four have to persist more than 30 days. Now, there's lots of things that they can do to kind of help you through that. And it's important, you know, it's a heavy day. When I was talking about PCIS, and Monday is a heavy day because everybody shares this. Well, then the first thing, Tuesday, we start talking about these heavy topics of post-traumatic stress disorder and compassion fatigue. So it's another heavy day. But I want people to understand, just because you may have a diagnosis of PTSD, it does not mean you are broken. I had undiagnosed PTSD for over a decade. I was able to move to another agency, pass the psychological, pass the physical, get promoted not once but twice. You can still function. It's just that it is taking a huge toll on your body. And if you don't address it at some point, your body will shut down and say, enough, I'm done. So the key is to try and stop it before it gets to that point. Dr. Chopko did a study, very interesting study, where he went around to roll calls to talk to police officers at the beginning of shift. 15 to 35% of the officers that he talked to and had do the metric to see if they had post-traumatic stress disorder could have been clinically diagnosed with PTSD at any given time and had no idea and were reporting for work. So it's important to realize that just because you have that diagnosis doesn't mean you're broken, doesn't mean that you have to stop working, doesn't mean that all of a sudden you're unable to be who you were. You can still function, but you need to address it. Because if you don't, that's where the issues come in. Something very similar to PTSD is something called compassion fatigue. Compassion fatigue is something that all first responders deal with. It's basically taking care of somebody else's crap. It's as a first responder, and I use police officers because that's what I've done for 25 years. People call us when emotions are very high, but I can't get emotional. They're calling me there because they want me to separate that emotional process and calm things down. So I have to act very unemotional. And where this was studied initially was in nursing home nurses who knew their patients were going to die. There's no question. They're going to die. But they still have to do their day-to-day job, putting their emotions aside so that they could give the proper care. And they noticed that that started taking a huge toll on the nurses. It wasn't that they had this overarching trauma. It was just the day-to-day problem of dealing with other people's problems. And as officers, what I like to talk about is we go from call to call to call. I work that horrific wreck. I have to put my emotions aside because I have to be able to do my job to get that person the help they need. And if I'm all emotional, I can't do my job. Well, what should happen is I should be able to, after that incident, take the time for my body to stabilize, the parasympathetic and the sympathetic nervous system talk to each other, calm everything down, but I can't. I have to take the next call. That next call may be nothing, or it may be something. So for 8, 10, 12 hours a day, we are constantly pushing our own emotions off to the side. Well, the problem is when we get home, we don't want to deal with those emotions because we know what's going to happen. I know seeing somebody hurt or dead doesn't make me feel good. I know that if I open this up, I may cry. I may have feelings that I don't want to have. Well, I've made it 8, 10, 12 hours without having those feelings and I'm doing okay, so I'll just put that box in the closet and not worry about it. Well, that's fine for a day, but then the next day you go to work and you start that same process over again. And that compassion fatigue is just that continually having to put your own emotions aside to deal with everybody else's. And what's interesting is that some of the ways compassion fatigue manifests itself physically is irritability, loss of sleep, avoidance, intrusive thoughts. And as you start looking at it, you start looking at PTSD. What are some of the symptoms of PTSD? Nightmares, insomnia, intrusive thoughts, short fuse. They're manifesting physically in the same way, but it's not the trauma that's doing it. It's having to shut off your own emotions and not dealing with your own emotions. It is not a diagnosable disorder. They recognize it, and what the mental health professionals are saying is that compassion fatigue is that precursor to PTSD, which is good for us in a lot of ways. Because if it is a precursor and we understand that when this is going on, there are steps we can take to overcome that, which is part of what your program does. It's that preventative portion. Once you start recognizing, I'm constantly tired, I'm not happy anymore, I've got a short fuse, my kids asked me a simple question and I blew up at them and it was over nothing. When you start recognizing these things, there are things that you can do to change it. So it's very key that you understand that. But that leads us into another issue that is fairly new. Hasn't been studied a whole lot, and that's moral injury. Moral injury was first studied by the military in soldiers that were coming back from Iraq and Afghanistan. There are a lot of similarities, and so I want to be really careful when we talk about moral injury that people understand what exactly that is. As first responders, and this is what they found in soldiers, there is a very high moral code or ethical code, a sense of duty, a strong sense of right and wrong, a strong sense of responsibility. That's why people volunteer to be in the military. In the Army, in the U.S., or in the military in the U.S., it's voluntary. So these people have a strong desire to take care of the underdog, to make a difference in the world. Well, that's the same thing that you hear in first responders. A moral injury is something that goes against that high moral ethical standard. One of the things that they talked about with the military is that 18-year-old soldier who is overseas and sees a 6 or 7-year-old kid running at him with a suicide bomb. They have to make the decision to shoot the child or let the child explode the bomb and maybe kill them, their friends, and everything else. That is a huge moral dilemma. And the ability to try and explain why I made that decision, most people can't understand. And it's that real abrasive, I just had to do something that I myself find morally wrong, but I have to justify it. What I talk about with police officers isn't such a stark example, but it's something that we feel quite often. As a young man, I was taught growing up, you never hit a woman. It is never okay to hit a woman under any circumstance. You just don't do it. So my whole life, this is ingrained in me. Part of my moral compass is I never hit a woman. What happened the first time I had to arrest a woman on a felony warrant for aggravated assault? And she said, I'm not going with you. And now I have to fight her. That causes a moral conflict of, wait a minute, I have held this belief and I have this moral standard, this sense of right and wrong that is now being challenged by a profession that I chose. Those constant conflicts take a huge toll, much like compassion fatigue. They take a huge, huge toll. There's a great book called Spiritual Survival for Law Enforcement. What is interesting about it is in the book, he talks about your emotions in your spiritual side being like a bank account. And there's 3 separate bank accounts. And as you go through your daily life, especially as an officer or first responder, you are giving away money from each of these accounts. And if you don't find a way to replenish that, you become bankrupt. Well, the spirituality and the morality are tied together. If you start having these moral conflicts and having to pay out of that bank account that you've got, you start losing that sense of what's right and what's wrong. And what happens with a lot of officers is that moral bankruptcy happens because it's just been tapped out and they've found no way to refill it. If you look at it, and I think is happening, Dr. Brian is with the military, and he did a study on it, and he came up with this chart. And let me blow this chart up.
That one.
Well, that's not the one. Let me scroll through this one.
Mm-hmm. Yes.
If you look at that center column, anger, depression, anxiety, substance abuse, insomnia, nightmares, those are all the physical manifestations of PTSD and moral injury. You can almost throw compassion fatigue in there, because when you look at compassion fatigue, the anger, the depression, the anxiety, they're all related, but they're caused by different things. What's interesting about the moral injury is if you look at that far side, grief, guilt, shame, alienation, lack of trust, difficulty with forgiveness. That is so common when you are talking to first responders about their trauma, as they start expressing, I felt like I should have done more, if I could have, should have, would have, all of these things. And that's what the military started noticing. A lot of the soldiers coming back were expressing that, but I should have been able to, because I have this moral compass, I have this high standard of ethical behavior, I should have been able to do something. There are two trains of thought right now, because moral injury is also not recognized by the DSMV. It is not a disorder, so to speak. They recognize it. They say that it is there, that it does cause all these problems. They readily admit that, but they haven't taken a step to say that it's a disorder, which is kind of sad. The two lines of thoughts are that moral injury is the same as PTSD, in that you can have one, or you can have the other, or you can have both. But they're not the same creature. Moral injury has the same symptomology, has the same mental aspects as PTSD, can still be very debilitating, just like somebody with severe PTSD, but it's not PTSD. The other camp that is researching moral injury says, well, wait, moral injury is more like compassion fatigue. It's a precursor. We recognize it. We recognize that there are separate symptoms, but it's kind of a precursor to PTSD. My personal feelings, and this is just Jeremy speaking, somebody who's done the research, but I'm not a doctor. And I preface that. I'm not a doctor. I'm not a physician. I haven't been through medical school. I'm not a trained psychiatrist or psychologist. But from my own experience, I suffer from PTSD and moral injury. Part of the issue that I had with the death of the 7-month-old was a severe trauma. That is one of those big T's. Part of what would wake me up in my nightmares, and what woke me up during my sleep studies, I had a nightmare. Even though I was medicated, I had a nightmare that I could not breathe. I was choking and suffocating in the dark. Well, this incident happened at night. And so it was my mind trying to process everything and process that trauma. So I had PTSD, there's no question. But I also had moral injury, which was distinct and different. Because as I was going through therapy, the hardest part for me to get over is the sense of failure as a police officer. Because my job is to protect people, to help people, to save people. And I failed. So there's a huge sense of failure as a police officer. There was a huge sense of failure as a father. What kind of father wouldn't move heaven and earth to save a child? And I failed because I couldn't do it. I failed as a supervisor because at the time I was a supervisor. And I had to, after this incident was over, look at the 4 guys who were with me and say, go back to work. What kind of leader has so little compassion? That is moral injury. And it was that wrestling within myself and that view of myself as a failure in not meeting my own standards of who I was in all the different aspects of my life, professionally, personally, familial, I can't even say it, as a family man, all of those, I was a failure. That has a devastating effect. And it doesn't matter how many times people say, well, there was nothing you can do. I understand that. Logically, I can understand that. But emotionally, I can't. And because I can't grasp that concept, and I have that struggle, what happens with moral injury is the same thing that happens with PTSD. Those stress receptors stay open, and they still get flooded by those hormones. And there's no way to shut them off until you deal with those emotions. And that's the hard part, is understanding I've got to deal with those emotions, because if I don't, I'm not going to get better. Now, that was a heck of a heavy topic. It is a lot of doom and gloom, because it's saying my body is taking control and my mind is taking control, and I have none. Well, yes and no. When I teach this course, and I can't do it here, but anybody who is watching, I want you to try this. Neurobiology and neuroscience is an amazing thing. There are little things that we can do that have amazing effect. Mm-hmm. Stand up, feet shoulder width apart, take a deep breath, pull your shoulders back, make two fists, not hands on your hips, but the fist on your hips, like Superman. Stand tall, chest up, 2 deep breaths, and you'll be amazed at how you feel. Just by doing that, doing nothing else. Stand up tall, deep breath, hands. They call it a power pose because it portrays power. I call it the mom pose because when I was a little kid about to get in trouble, there was that look. There was that, oh, here it comes. But for that person, there's just a sense of well-being that comes from that. You feel better about yourself because you're standing up straight. You're taking the deep breath. The next thing that I have them do, and it gets a little uncomfortable because in PCIS, spouses are allowed to come, but not everybody brings their spouse. So when I pair people up, sometimes you're with your spouse and sometimes you're not. But there's a fun exercise, and I have yet, it's supposed to be for 1 minute. I have yet to let this exercise go more than 20 seconds and not have everybody in the room laughing and smiling. What you do is you keep that Superman pose and you force a smile. And I know after this heavy topic and everybody just bearing their soul, I'm not going to smile. Okay, doesn't have to be a real smile. Force a smile. Turn around, look at your partner. Don't say anything, but keep that pose and keep that forced smile for 1 minute. People can't do it. Neurobiology, even though you may not feel like smiling, that act of forcing the smile and keeping it there activates that parasympathetic nervous system. Starts flooding with the happy emotions. I get in lots of trouble with this because I tell people you need to massage your vagus nerve. The deputy commissioner of the whole academy for the state of Kentucky heard me say that, and he was like, I'm like, no, seriously, there's this thing that's called a vagus nerve. It's the 10th nerve. It runs from the bottom of your brain, and it's called the wandering nerve for a reason because it goes up through your ears, down your neck, into your, it just goes everywhere. It doesn't have any particular place. It just wanders everywhere. But if you activate that vagus nerve, it does a lot of fun things to help reduce that stress and activate that parasympathetic nervous system. When you smile, you are actually activating, in a way, the vagus nerve because the hormones have to pass through there, and it goes, hey, this is a good thing. And it's amazing to watch in 20 seconds people smiling and laughing after dealing with such a heavy topic. And try it at home. Just don't even have to tell somebody what you're doing. Put a smile on your face, walk up to them, and just smile. Don't say anything, just smile and see how long before they start smiling. I have yet to go beyond 20 seconds with a whole room. Which brings us back to the vagus nerve. There are simple things you can do.
So many.
People rub the bottom of your ear. It activates the vagus nerve. Right behind your ear, if you feel there's a little indentation, and if you put pressure and just rub right down the side of your neck, that's massaging the vagus nerve. It's activating.
Sorry, that's the same nerve that causes snoring and has an issue with sleep apnea as well. We do a lot of training in my program with that aspect of that nerve, that one branch. But yeah, we do all of them in the program. Yeah.
And when you do that, it activates that vagus nerve, and it activates the parasympathetic nervous system, which says it kind of cleans out the stress hormones. It sweeps them away, says, okay, so that those stress receptors can shut down and the body can go back to that homeostasis that I kind of like being in the middle. Mm-hmm. It's interesting that a lot, if you look at the vagus nerve and treatments, one of the things that I talk about with treatments for PTSD and moral injury, I talk about very invasive ones first, because I want to get those out of the way. People, these are for extreme cases. Please understand that. This is not typical. There's one called, for PTSD, it's a stellate ganglion block. Highly, highly invasive. And unless you are part of the U.S. military, who I believe is the only one doing it right now, you won't get it done. Because what it takes is it takes a doctor to inject an anesthetic blocker into the stellate ganglion nerve, which has to be done under x-ray because it goes into the neck. So while you are in an x-ray, the doctor has to look at the x-ray to ensure that they get that nerve. Highly invasive. However, people who have had it done have said that it is amazing. One of the people that I go to the post-critical incident seminar with is a doctor. He is a psychologist, and he said he talked to Dakota Myers, who is a Medal of Honor winner. And apparently he has these done. And he only has to have it done once every 6 months, maybe once a year. But apparently the relief, the brain shutting down and allowing him to go back to normal is almost immediate. Highly invasive, not a big fan of needles, so I wouldn't recommend it. With the vagus nerve, there are two invasive things that happen with the vagus nerve. Interestingly, one of them has to do with digestion, and they actually cut open your stomach. They put this machine in that actually shocks, for lack of a better term, or stimulates the stomach to help with digestion and things. And it's helpful with morbid obesity because it activates the stomach, helping the stress to go away and the parasympathetic nervous system to work, for the stomach to work properly.
Wow. I would have to look into that one a little bit more, because I understand with all the nerves, there's and they're unmyelinated sheaths down there where your diaphragm is. But with digestion and stuff, that sounds to me almost like such a severe way of treating it, when I know of, I have a colleague that works with unbelievable digestive issues where people just can't even leave their house. And there's so many other things that can be done, but that's from it's similar to what I do, where it's that holistic thing where people would almost rather go and do these crazy procedures that are where our medical system is built on crisis, which we absolutely need. But
Right.
there's other ways of sometimes doing these things. And that's where like all this stuff with the vagus nerve, like big part of my program is vagus nerve training for snoring, sleep apnea, for all the digestion, for all of these things and all the hormone alignment and all of that. And then, and as you say, there's so many different simple aspects of it.
Right.
But like doing that, I don't know why, when you, all the other things, I'm like, yeah, no, that sounds interesting. Like, definitely we can do this. But this one here, I'm like, I would try all of these other things first, because there's so many other ways to get those hormones aligning and doing what you need and working it all together. And that's where I find as well that like officers who are struggling with the therapies, if when we get in there and we help them, give them that extra boost and extra support for their hormones, it gets their physical system that ability to relax a little and get those stress systems down a bit enough so that they can then make headway in those treatments and do it as well. So some people, I'm finding some people, the treatments, their system is at a point where they can get them down on their own, but some need that physical help, which is what like I do. And then they can get that where too.
Right. And that's why I said I'm going through the extremes first. And this is our extreme because they're very invasive. It actually is surgery to resolve this. And the other one,
sorry, just one sec. If you could keep talking, I need to grab my power cord because my computer's going to go off.
Sure.
1 second.
But the other one is still deals with the vagus nerve. It's an implant that goes in your chest, and then it ties into the vagus nerve on the neck, and it stimulates just like it does the stomach, sends little stimulations, little shocks to stimulate the vagus nerve in the neck. And again, that's very, very invasive. Don't recommend it, but again, not a doctor, not a physician. But I don't recommend it because it's just like a port in your chest, and it sits on the outside to stimulate the vagus nerve on your neck. And there are so many things non-invasive that you can do. We talked about massage. A lot of people are like, I don't know. Go do a massage. Let them actually do a deep tissue massage. Feel the difference. One of the things, and at PCIS, that's one of the things that they offer on Tuesday night, is they have massage therapists that come in to do that. The other thing that they do, and another way to activate the vagus nerve that is so simple and so easy to do and so non-invasive, is breathing. One of the ladies that attended PCIS does Nidra yoga. And when you mention yoga, everybody's like, I can't, I'm not flexible enough, I can't. It's basically breathing in a guided meditation. And what is funny is when she does this, all you have to have is comfortable clothes and a pillow and a mat to lay on. That's it. And it is so funny to watch how people who haven't slept or have problems sleeping do this deep breathing guided meditation and fall asleep almost instantly. And it's funny to watch. Some of them don't want to do it after they've done it the first time because, you guys woke me up and I was snoring. I was so embarrassed. There's this room full of people and I was out so hard. I was snoring. And it's like, but relax. That's the whole point. It's trying to teach you how to relax simply through breathing techniques, deep breathing techniques, and relaxation. I know somebody was asking about meditation and does it work? And it's hard for me to shut my mind down. I get it. A lot of people are there. It's not a fix-all. It doesn't work for everybody. But if you try, one of the things to think about when you're doing meditation is maybe look at somebody who does the deep breathing yoga. It's not stressful. You're not bending and contorting your body. You're simply learning how to breathe. The funny thing is, most police officers who have done any kind of tactical shooting, snipers, anyone who shoots competitively just for fun, already understands the concept of the deep breathing. We call it tactical breathing. You take a deep breath in for a count of 4, you kind of hold it for a count of 4, you blow it out through your mouth for a count of 4, you hold it for 4, and it's just that cycle of breathing. That's one simple deep breathing exercise to help start calming your body down and start getting the parasympathetic nervous system to take over. And that parasympathetic nervous system is what calms the body and says, we can relax. So it's those little things that you can do that take very minimal effort, but have huge gains when you can do it.
And that's where, with my program, we get all those hormones aligned, do all that, and walk through that process, like step by step with them as well. Yeah. So this has been amazing. I appreciate, I know you have to go and you're working on your doctorate. Is that what it is?
Yes.
So I know you have a deadline that you need to be getting into as well. So just for everybody that's here, I know that the program that you do is in Kentucky. If you could just give people some information in case they want to reach out, or
Sure.
and other states that it covers and things as well.
The post-critical incident seminar is what we have in Kentucky. It was actually a program started by the FBI back in the 80s. The Employee Assistance Program is how it started. It's a 3-day program. South Carolina picked it up. They've been doing it for 20 years. Back in 2017, Kentucky started it. I know there are, I think, 13 states that have this program. It's a 3-day seminar where they talk about educating, because if you understand what's happening, you can kind of process. And like I said, it doesn't stop it. Like with me, when I put my vest on, it didn't stop that stress response. So please don't think that knowing what's going to happen is going to stop it, because it doesn't. I still had that stress response, but because I was aware that it was going to happen and I knew that that was normal, I could sit down on the bed, take a couple deep breaths, okay, it's fine, and work through it. So what they do over these 3 days is kind of give you those coping mechanisms, kind of let you know what's happening. And then you get to see a mental health professional. And one of the things that they do offer is the EMDR, which is an amazing therapy. I call it voodoo. Mental health professionals get mad at me when I call it voodoo, but it's amazing at how it works. And again, it doesn't work for everybody, but it is a tool. Over those 3 days, they do that. And then there's some follow-ups, 3 months, 6 months, and a year later. You can come back to the program as many times as you need. I know right now, I want to say Kentucky, Ohio, South Carolina, Georgia, Florida, Texas, all have the program. There's some more. But if you have questions, reach out to your employee assistance program. I know a lot of them are not worth their weight sometimes, but just see what's there. If you want to know more about the PCIS program, and if you can come, I know that you can go to kypcis.com, which is a Kentucky program, and it kind of lays out things for you. Larry, who is over the program, and Stan, they work for the Department of Criminal Justice Training. There's an entire branch devoted to police wellness in this program. They will be more than happy to work with you, tell you where programs are that are near you, or help lead you in the right direction. And if it's something that is serious where, you know, I need that help now, I'm really struggling with this trauma. I know that we have in the past taken people from out of state and said, you know what, we'll make that exception. Come on, we'll figure out a way to get you help, because that's what it's all about. We understand the job, the profession, and we understand the need for help. So I highly recommend that you reach out. And if you have any questions, you can reach out to me. Email is jjdavis1972@gmail.com. That goes straight to my phone. So, just, hey, saw your presentation, had some questions. I'll be more than happy to help you out however I can.
Great. And can you leave the web link as well as if you want your email as well in the comments for everybody in the Facebook group? You don't have to do that right now. I'll tag you in it.
Okay. Yeah.
I have another meeting to scooch to right now, but I will tag you in that. And if you could put the links in there for everybody, that would be amazing.
Absolutely. Were there any questions by chance?
We do. I really do have to.
Okay.
I was supposed to be 5 minutes ago in another meeting. They're messaging me. So there is one from Chris of which I'm going to check into. You can even go into the Facebook group and see if because it's a bit of a medical, he has a coil wrap around his vagus nerve. So I'd have to. That
would be something that you would have to talk to a medical professional about, because we're getting into complicated things there. And
I don't know, like it may be influencing. I don't know how to answer that one as well. So, Chris, I can maybe give you some things to be asking your medical professional to find out, because they may not understand what we're talking about on our end to find out if there's a correlation, but.
And that's key. Like I said, with that 15 minutes, the more you can give them what you're feeling and thinking and looking at, the better it will be to help you.
Yeah. So Chris, I'll reach out to you and give you some questions that you can ask them to maybe find out some answers that, we can't. All right. Well, thank you so much, Jeremy. This has been so helpful. I mean, you've taught me so much, and I'm sure that everybody in here is also feeling the same. So thank you. And thank you for what you are doing to help.
I appreciate it. Thanks for having me.
Thank you.